Lee Gilbert. I'm a school nurse here at the Learning Center at the Health Center of Excellence. This morning I am going to tell you a little bit more about communicable diseases. You can abbreviate it CD. We are going to just go through the lecture. Here we go. So we are asked, what are diseases? For instance, you're sitting at an airport and you see a couple of people coming out with masks on their face from a flight. And you know, okay, I should probably avoid these people. They might be carrying something that I don't want to take with me. And you strike up a conversation with a lady next to you that said she had such a hard time to get her insulin and her syringes onto the plane with her. She's diabetic. And she's not wearing a surgical mask, so you aren't really worried about catching diabetes. But why? It is a life-threatening disease. So we're just going to look at firstly the main differences between the common diseases, but speak mostly about communicable diseases. So a disease is any abnormal condition that causes a disruption in the functions of body tissue, organ, or entire organism. And we know that there's a specific set of symptoms. You think, for instance, a cold, a flu, measles, cancer, stroke, or diabetes, just to name a few. These diseases all disrupt the body in very characteristic ways. You think about what causes these conditions: viruses, bacteria, fungi, smoking, genetic defects, etc. And there are countless diseases, and each of them have their own unique and characteristic cause. But why can you catch some diseases but not others? That is two different types of disease that we know: communicable and non-communicable. So basically, communicable, you're going to see, is an infectious disease transmissible by direct contact with an affected individual or the individual's body fluids. If they have a big sneeze on top of you and you have it in your it connects with any part of your face, for instance, onto your tongue or into your eyes, or by indirect means. For instance, you touch a door and then you touch your face, you are at risk of contracting this disease. So communicable disease is an infectious disease that is contagious. The pathogens are the ones to blame. They cause the communicable disease. So the pathogens are microorganisms. They enter the body and then they multiply. The types that you see are bacteria, virus, fungi, and parasites. Bacteria, we know, is a single-cell microorganism. It releases toxins, and some are friendly and some are not so friendly. This you can see the strep throat, so strep pyogenes. You see gets white tonsils. You can have strawberry tongue, like we see here with this tongue sticking out. You can have the rash, urinary tract infections, food poisoning. And so the food poisoning is because of the bacteria in the food. Tetanus, it's the bacteria on objects, and tuberculosis. Those are all bacteria that can cause you to become sick. So did you know that bacteria is microscopic single-celled organisms and they lack a distinct nucleus? They may be shaped like spheres, rods, or spirals. They inhabit virtually all environments, including soil, water, organic matter, and the bodies of animals. Many bacteria swim by means of a long whip-like structure called a flagella, and the DNA of most bacteria is found in a single circular chromosome and is distributed throughout the cytoplasm rather than contained within a membrane-enclosed nucleus. We see viruses. We have a virus, and it thrives by entering the cells and completely taking over. They multiply, and you see an example of that is a cold or a flu. On average, people get 8 colds a year. Young guys, we see that a lot of colds going around. Ebola, we don't want to see that going around, and Zika is an example of a virus. Here's a picture. So did you know a virus is any of a large group of submicroscopic infective agents that are usually regarded as non-living, extremely complex molecules, or sometimes as very simple microorganisms that typically contain a protein coat surrounding an RNA or DNA core of genetic material, but no semi-permeable membrane, that are capable of growth and multiplication only in living cells, and that can cause various important diseases in humans, animals, and plants. So I have a communicable disease chart here from American Academy of Pediatrics. It is really a good chart if you want to go see exactly which disease and their signs and symptoms, and whether or not the child should be excluded from school, and for how long and until when. There's reportable diseases in Florida that you as a school or as anybody that has staff or children in your facility needs to know about, and it also gives you instructions on how to report any of these diseases. So next we are with fungi. Fungus is any kind of a kingdom of saprophytic and parasitic spore-producing eukaryotic typically filamentous organisms formerly classified as plants, and now they're thinking, is it really a plant because it lacks chlorophyll, and it includes mold, rust, mildews, smuts, mushrooms, and yeast. So we see with fungus, there's about 1.5 million different species of fungus. We have the first example here is the Aspergillus fumigatus is one of the pathogens that can cause aspergillosis. As you can see here, this is the post-mortem. It's the lung of a chicken. You see these little patches. Here's a plate of it when they cultured it, and pretty much looks the same here as there. You can see the patches are similar. It makes you very sick. In chickens, it causes them to not be able to breathe. In people, also the same symptoms, pretty much. Is athlete's foot is right there, but especially between the last toe, the next toe. You'll see it starting there. It's red and inflamed and really painful, and then it can spread to the whole foot, and your feet can start scaling. Then there's yeast infections, and there's our ringworm. We have parasites, and that's an organism that lives on or in a host and gets its food from or at the expense of the host. An example of this is malaria, pinworm, and head lice. Malaria, you see the different stages, and you can see according to the latest World Health Organization estimates released in December of 2015, there were 214 million cases of malaria in 2015 and 438,000 deaths. That number has gone down from 1 million over the last couple of years. So pinworms, we'll see itching is commonly seen in people with pinworms, and generally how you can prevent that is decontaminate the environment by washing underclothes, bedclothes, bed sheets, towels. Always wash your hands, and proper toileting Keep the fingernails short and avoid nail biting. And you will see if one family member has it, you can probably suspect the whole family to have it. Spreading infectious disease is contact with contaminated object. Most pathogens die quickly outside of the host, but some can live on objects. The physical contact with an infected person is skin-to-skin contact or a sneeze. As you can see, that big old sneeze over there. And environmental sources, food, water, soil, food poisoning, fungi, and mold. And in contact with contaminated animals or bites, for instance, rabies. Stages of disease. So, of course, there has to be exposure. That's the contact with the pathogen. There's going to be an incubation period where there's growth or maturation. And the prodromal period is slight signs and symptoms. You're starting to become achy, sore, tired, and you are contagious in this phase, in this period. And then there is the acute stage where there's most noticeable signs and symptoms. Convalescence is the period at which the symptoms begin to fade until the time the patient recovers from the disease. And hopefully you'll have immunity to a specific disease then afterwards. Not always. So what is the most effective means of preventing the spread of infectious disease? So can you guess it? Yes, hand washing. You wash for at least 20 seconds, and if you don't know how long 20 seconds is, you can sing happy birthday twice to yourself. And remember tops and bottoms of the hands and in between the fingers. To better understand what is a communicable disease, we're going to just compare it real quick between a communicable and a non-communicable disease. So a communicable disease are diseases that can be spread from person to person. Some examples are the cold, there's strep throat, chickenpox, and one way to prevent spreading diseases, for instance, is sneeze into your elbow. So go achoo, and you can teach that to anybody that needs to learn that beforehand. And it's a great way of not spreading diseases. And then, of course, if you sneeze into your hands, to wash your hands immediately. The non-communicable diseases are diseases that can't travel from person to person. So those are diabetes, heart disease. I hope you understand the difference and what is a communicable disease. The deaths reported, so we're wondering which have more deaths reported, infectious diseases or the non-communicable diseases, the NCD or CD. So non-communicable diseases were responsible for 68% of all deaths globally in 2012, up from 60% in 2000. The four main non-communicable diseases are cardiovascular diseases, cancers, diabetes, and chronic lung diseases. Communicable, maternal, neonatal, and nutrition conditions collectively were responsible for 23% of global deaths, and injuries caused 9% of all deaths. What is the best way then? What can we really do to prevent disease or infection? Again, just wash your hands as often as you can. How to prevent communicable diseases, handle and prepare food safely. These are just a few ideas. So wash your hands, utensils, and surfaces often when preparing any food, especially raw meat, and always wash fruits and vegetables and dry them off. Cook and keep foods at proper temperatures, and don't leave food out refrigerated properly and promptly. Clean and disinfect common used surfaces, so pathogens, some of them can live on surfaces and for a long time. So cleaning with soap and water is usually enough, but you can disinfect your bathroom and your kitchen regularly, especially if someone in your house is ill. Also change your toothbrush out after an illness like strep throat. You can use an EPA certified disinfectant and bleach solution, but please keep that away from anybody that would it be dangerous for them, that they might want to drink it, and keep that up high on shelves and marked that this is bleach. You can also use vinegar or rubbing alcohol. Cough and sneeze into your sleeve, and whenever you have to cough or sneeze, just cover your cough and teach that to your little ones. A few other ideas is do not share personal items. So you're going to want to avoid sharing personal items that can't be disinfected. You don't want to share your toothbrush or your razors. And sharing towels, needles should never be shared and should be thrown away properly, discarded properly. You're going to want to avoid touching wild animals. And you and your pets should avoid touching wild animals which can carry pathogens that can cause infectious diseases. And of course, if you are bitten, always go talk to your doctor. Just please stay home when you are sick. Don't go to work if you have vomiting, have diarrhea, or have a fever. If you take something that's going to reduce your fever, that doesn't mean that you don't have a fever. Don't send your child to school if he or she has these signs and symptoms either. Increase your self-awareness, watch the news and keep track of any outbreaks of communicable diseases in your area, and maintain a good understanding of how these diseases are transmitted. Are they airborne? Are they passed through bodily fluids? And then try and protect yourself. And please remember, do not forget to wash your hands as often as you can. All right. Well, thank you so much. I hope you understand a little bit more about communicable diseases. And if you have any questions, you can always ask me or email me. Thank you.